Just looking to see how many folks are with us. All right, so what we're gonna go ahead and do is let me get this meeting started. And I'm gonna ask, so first of all, let me just welcome you to our Reentry Committee meeting. I know all of you are on Zoom, so I'm just gonna remind you which Zoom you're at, our Reentry Network meeting. I'm gonna ask Nancy if she can start us by calling the roll.
Member McClinton Brown.
Here.
Member Smith.
Here, thank you.
Member Tomalinas.
Here.
Member Binder. Member Zahner.
Here.
Member Smith.
I think that one's me, so I'm here.
Thank you. Member Keeley.
I'm here, thank you.
Member Garnett.
I'm here. Good afternoon, everyone.
Member Cody. Member
I'm here.
Maya.
I'm sorry, Nancy. I just wanted to say I'm here as Dr. Cody's alternate, Rhonda McClinton Brown.
Wonderful, thank you. Member Maya Esparza. Member Molly O'Neill.
I'm here, thank you.
Member Damon Silver.
I'm here, thank you.
Member Jeff Rosen. Member David Angel.
I'm here, thank you.
Member Pat Nicolai. Member Mendicacci.
Here.
Member Singh. Member Terrell. Member Mills.
I'm here. Thank you, Nancy.
Member Dewan.
Here.
Member Bonduras.
Present.
Member Gaxiola.
Present.
Member Fisk.
I'm here, thank you.
Member Marquez.
Here.
Member Reagan.
Here, thank you.
Member Helcon. Member O'Brien.
Here.
Member Amador Lebeau.
I'm here, thanks.
Member Trinidad. Member Williams. Member Yee. Member Clifford.
Here.
Member Manley.
Present, thank you.
Member Hernandez.
Here, thank you.
Member Day.
Here, thank you.
Member Perumata. Member Crooker Cook.
Here.
Cook, I'm sorry.
Present.
Member Mukoyama. Member Vujeni.
Alternate 27, Juliana Ibrahim.
Thank you. Member Mata. Member Joseph.
Yeah, Paul Joseph, I'm here, thank you.
Thank you. Member Miranda. Member Kendrick. Member Ellenberg.
I'm here.
And Chairperson Chavez.
Here. Thank you. I know we have a quorum. Am I right, Nancy?
Yes, you are correct. I was just counting.
That's a lot of people. So I'm sorry. I know, but we do this twice during this meeting. I'm now going to go to public comment, and this is an opportunity for people to speak to this committee on items that are not on the agenda, but within the purview of the committee. I see no hands raised. I'm going to come back to the committee to item 3, and this is to approve our consent calendar and any changes to the agenda. On our consent calendar are items 10, 11, 12, 13, 14, and 14. This is item 10 is about our continued remote meetings. Item 11 is our revised meeting schedule. Item 12 is our reentry network work plan. Item 13 is the Reentry Resource Center quarterly dashboard. And item 14 is the updated 2-year adult strategic implementation plan for 2023 and 2024. With that, I want to see if there are any items that any of my colleagues would like to take off the consent calendar. And if not, I'd like for a motion for the consent calendar.
Move approval, Judge Manley.
Thank you. A second?
Second, Ellenberg.
Thank you so much. I see no hands raised, and so I'm sorry, Nancy, if you can do this again.
Sure. Member Smith. Member Smith?
There's two of us. I'm
Aye.
here,
Sorry.
she's here too.
Lori Smith.
Aye, thank you.
Member Tomalinas.
Yes.
Member Zayner.
Yes.
Member Jeff Smith.
I'm here.
Member Garnett.
Yes.
Member McClinton Brown. Member O'Neill.
Yes.
Member Minakachi.
Yes.
Member Angel.
Yes.
Member Mills.
Yes.
Member Dewan.
Yes.
Member Gaxiola.
Yes.
Member Fisk. Member Fisk. Member Reagan.
Yes.
Member Marquez.
Yes.
Member O'Brien.
Yes.
Member Amador Lebu.
Yes.
Member Clifford.
Yes.
Member Manley.
Yes.
Member Hernandez.
Yes.
Member Day.
Yes.
Member Proctor Cook.
Yes.
Member Brahim.
Yes.
Member Joseph.
Yes.
Member Ellenberg.
Yes.
And Chairperson Chavez.
Yes, thank you so much. We're now going to move to item 4. Yes, and this is item 4 is a report back. I'm sorry, I've got a couple different numbers here. Item 4 is to receive a report from the County of Santa Clara's health system relating to the options consideration regarding establishing a 24/7 pharmacy at the jail and the Office of Reentry Services. So this is item 4 on our agenda. And I don't know if I want to say thank you for the report. And if the staff wants to maybe briefly go through it, and then Dr. Smith and Dr. Day, I think we're having a conversation with the two of you.
Okay, and good afternoon, Chairperson Chavez and members of the Reentry Network. And I'm going to try to pull up the PowerPoint presentation. If you can just give me a moment. Let's see. Okay, can you see that?
Yes.
Okay, great. Okay, and good afternoon again. And this is Eureka Day reporting on the options for consideration for regarding establishing a 24/7 pharmacy. There were 2 PowerPoints that were attached to this item, and one on the access to prescribed medications at release for patients was attached to December 8th and is serving as a reference. And since the request of this item for establishing a 24/7 pharmacy, there has been a decision on the new jail. And since we have also discussed this, I'm looking at the space, and I've had a few meetings looking at the new space and design of the new jail, and have earmarked, if a decision is made, earmarked space for a pharmacy in the new jail. But in the interim, we are following our consent decree, and the consent decree basically says that any patient who is in our care for more than 7 days is leaving with a 30-day script. Those patients are evaluated at release by either a physician and or psychiatrist for reconciliation of medications when they're leaving. And then, of course, there's a script in the health link at the time of release, so those patients can get that script upon release. And I've talked about before where we had different kinds of release, and our current medication process upon release is that we have those court order patients where we have input time, we have advance notice. Those patients 100% of the time leave with a script in hand at discharge and release, and that's the 30-day script. We have those scheduled releases, and this is a process we're still putting in place because I'm still onboarding staff. But again, those patients are working with our medical clerks who are getting the list from CJIC and from our custody bureau colleagues. We're crosswalking those in our health lane, and then of course prescribing that 30-day script upon release. And then for unplanned releases, which we have a number of unplanned releases, we're still working with our clerical workers who are crosswalking again in health link and making sure that there is a prescription for 30-day medications that the patients can pick up within 24 hours and or the next morning at any of our county pharmacies. In the interim too, once a decision is made on a new pharmacy, and particularly as for the new jail, we are doing a number of things. And one of the things that I'm doing currently is a number of years ago, there was a pilot looking at the Navitus Health solution. This pilot never got off the ground several years ago, and I'm revisiting that pilot and currently working with contracts to look at how we could institute this pilot again. Basically, it would allow for late night releases. It would allow for patients to go to any retail pharmacy that's 24-hour. And it also will run similarly to how it has worked with Valley Medical Plan, where members with prescriptions can pick up any medications at release at any selected retail pharmacy that's open 24 hours, 7 days a week. Part of what we're doing right now is in looking at this contract again, is having to formulate an itemized list of the medications for purposes of the contract. Itemized lists that were looked at years ago are not the same formulary that we're using now. We're also determining the pricing for the formulary and what medications we will be contracting for with these retail pharmacists. We're meeting with the Navitus team to look at any new capabilities of their technologies for consideration and identifying community pharmacies in a network that is geographically suitable in a catchment areas to the main jail in Elmwood. And then determining again the benefit eligibility verification system and what that needs to look like. And then the capabilities of the prescription chain to track these patients and tracking the patients who are going to these retail pharmacies 24-hour, who are actually filling their scripts, and being able to track the utilization of the Navitus contract and the Navitus Health Solutions. So that's one thing that we're looking at. Another thing we're doing currently, and we have a project going right now where we're looking at Keep on Person. And Keep on Person, we are piloting this currently. We have 19 patients that have been screened who will be able to keep medications on their person. This is common in many jails right now, and it's allowing patients to keep a set of medications up to 30 days supply that they're self-administering daily for themselves. There's certain medications, of course, that are being looked at. Many of these are essential medications that the patients are taking because of chronic disease. And then the prescriptions are reordered, meaning that when the patient is getting to at least 10-day script, they're reordering the medication. So they're always being refilled in a real time. And so that way the patient, when they leave, they have these scripts on hand as well. So it does enable the patient to have a supply on hand during impromptu discharges and allowing time for transition to post-release prescriptions. And so this is a pilot. We're putting that in place now. We're working very closely with our pharmacy colleagues at Valley Medical Center. Matter of fact, they are on our team, and we're identifying those essential medications now and starting a pilot. And so that's what we're doing in the interim. But that's the that concludes my report. So if there's any questions, I'll take those.
So let me go to the public and see if there are any comments from the public before I come back to the board. I see no comments from the public. I will come back to the board for comments. Colleagues, I just wanted to, before I go to you, Supervisor Ellenberg, I just wanted to raise that this has been a focus of discussion now for probably 5 years. And Dr. Day, I recognize you're new, and that's partly why I'm prefacing my comments to say this is not really related to you or to your work. What I would like to ask is more to the point. Dr. Day, I just want to say back to you what I think you just said in your presentation, that you are looking at the new jail for a location for the pharmacy.
Correct. I've identified space already.
All right. And Dr. Smith, let me see if you're on still.
Yeah, I'm on.
Great, thank you. Yeah, you're a little light. Oh, we're getting a little echoey too. But Dr. Smith, I haven't seen the new location. So I mean the new jail. So what I'm presuming is that the location that's being discussed is one that is part of an old rendering or a newer rendering.
Yeah, it's the old rendering. We're gonna have to, after the board's action to move ahead with the new jail, we're gonna have to come back to the board with additional design imperatives. We need to add back booking. We'll need to look at expanding some health services and dental services and behavioral health services, and we'll need to discuss the possibility of pharmacy. So
I'm sorry, did you say possibility? So it's not a embedded programmatic issue? I mean, it's not a settled programmatic decision?
the design of the new jail won't be settled until the board approves it. The board will have to review it again, and I'm sure we'll have a lot of discussion about the entire design. So I don't think that we can say that there's a specific space right now that's approved because the board has to. But certainly that'll be a subject that'll be discussed, and there'll be recommendations from staff about where to put it.
All right, Supervisor Ellenberg?
Thanks so much. Yeah, that statement about space already having been identified panicked me a little bit, because we haven't approved design and we haven't really pursued that conversation yet. But Dr. Day, thank you for the report. I'm curious to know, in the interim, are you thinking about or considering pros and cons of placing a pharmacy on site at Elmwood or the reentry center to better facilitate access to medications?
And part of it is just the resources and having a pharmacist oversight and pharm techs. And part of the pharmacies, you have to have all medication behind a double locked door, and it has to have that oversight for distribution. And our nurses are doing the administration, but as far as distribution, that would have to come through a licensed pharmacist and pharm techs and oversight. We have just purchased a new, in place of the Talus, a new sort of, high-end medical dispensing machine. However, that's right now housed at Valley Medical Center. And so our support for medications comes directly from Valley Medical Center. And so we do have that basically medications coming over, doing the manifesto, doing the count, accepting those medications, and then of course administering the medications. As far as space is concerned, with the limited space currently, we just don't have the retail space to put a full-fledged pharmacy in either site right now.
Okay, so it sounds like the barriers are both the specialized nature of a pharmacy and physical space.
Yes.
So asking about costing out what it would take to provide a satellite pharmacy is not something you recommend, correct?
We would have to build it out.
Okay.
And so I haven't seen pharmacies that are not within a facility. So we don't have the space right now to put a pharmacy in place, nor the resources or the staff.
Yeah, there's no space available at
Thank
this
you.
point. We'll have to build a space. In the new
Yeah, that would have to be built out.
Thanks. I have some other questions that I will move to. Page 2 of the report indicates that process changes will be implemented at least for planned releases by March 1st, 2022, but it doesn't specify the changes. Is that the implementation of the dedicated discharge unit, or is that something?
Yes, ma'am. And we're still trying to get that in place, Supervisor. We have positions that have been earmarked for this discharge and we're still getting those positions hired. We have been flying the positions for some time. We've introduced several staff, some have come on, and then they subsequently have left. These are medical unit clerks who have left to Valley Medical Center and other jobs. And so we have earmarked positions, as you know, through the restructure plan. Part of that design, we will have these medical unit clerks as part of the discharge unit on every shift, and they will work in tandem with the release officers. So as the officers are releasing, regardless of the time of the day, we will also have a medical unit clerk as part of the discharge plan, and they will work in tandem. And so they will assure that each patient, regardless of the unplanned discharge and or planned, will leave with their 30-day script. And so that's the plan right now in the interim with this discharge unit. We're also putting a discharge plan around the whole person care. So it's not just these unit clerks, it's the entire team will be looking at medications prior to discharge, doing that reconciliation and making sure that the patients leave with those scripts, regardless of time of day.
It's interesting and concerning to hear that you're having trouble hiring folks. And I wonder if there's something that needs to be adjusted in the classification or the description. I'm sorry to hear. I'm glad we're keeping people in our system if they're moving to VMC, but sorry to hear that we're not able to keep them for this program. Are there changes that you think need to be made to make the position more attractive?
I'm working with ESA, and I have 3 different meetings on 3 different levels with ESA, and we are looking at how the job bulletins are run. As you know, because these are codes that are used across several different venues, not specific to just custody health services. When folks apply, they often apply to medical unit clerk, and then they're called by different places, Valley, St. Louis, and or O'Connor, and or custody health. And so the offer is on the table at a lot of different places. And so folks tend to have options where they go. And because sometimes the job bulletins don't specify custody, and you're going to be actually working in the jail.
So maybe we need to be clear up front.
So we're actually embedding that now in job bulletins and actually changing some of the verbiage so that folks are clear where they're interviewing.
Good, thank you. I have just a couple more questions that I'll try to go through very quickly. The data is showing us that only about 1/3 of patients are actually picking up their medications, and I was glad to see among the process improvements being considered in the report is a statement that custody health will monitor improvement to determine if additional steps are necessary. I'm curious to know what would be considered an acceptable level of medication pickup to meet the intent of the consent decree and demonstrate that changes were successful. What is our target? Is it 50%, 90%?
As far as picking up medications, that's not part of the consent decree. It's just that if they're there for a certain amount of time, they will leave with the script. What we're doing is if we do this Navitus contract, we are trying to put those capabilities in place so that we can have that information coming from the retail pharmacy so that we can track how many patients are actually picking up their medications. That is a capability that we're looking at. And so that way we can track if patients are actually making it to the retail pharmacy, if they're actually picking up their prescriptions. And so that was a tracking mechanism that we were putting in place to just track the utilization.
And so again, then, so thank you for clarifying about the consent decree. At what point will you look to add in more if it doesn't get up to 50%, if it doesn't get up to 80%? You know, I assume you're concerned about the 1/3 pickup.
Absolutely. And so once we put those systems in place to be able to track that retail and the utilization, I think we'll have a better means of understanding what the opportunities are to improve that that utilization.
Okay, thanks. And just my last question is about CalAIM. Can you just briefly say where CalAIM fits into the issues in the coordinated release and continuity of care? And I'm curious who's leading the planning inside of HHS or custody health on potential changes to operations based on new opportunities for care in jail presented by CalAIM.
Absolutely. And with CalAIMS, I am working with the California Advancing and Innovating Medi-Cal Justice Involved Advisory Committee. So I do work with the advisory committee as a consultant and letting them know how, you know, the entire process for Medi-Cal and making sure that patients have adequate and or viable, you know, Medi-Cal and or affordable care when they leave here. We're building that into part of the restructure of the whole person care model, looking at how do we assure that patients have applications prior to release and positions in order to do that. And so typically when you do an application for Medi-Cal, especially in this setting, if a patient has viable Medi-Cal coming in, that's suspended while they're here because we don't charge for services. And so the suspension is lifted once they're released. If they are needing additional resources, for instance, in the interim, if they go out, then they could actually reinstitute that Medi-Cal. Now, if we have patients where the application is started while they're in jail, that can take up to an 18-month process, if not more. And so if we started, somebody has to follow them through. So what we're looking at is what are those positions that if we start the application in jail, and we're working very closely with our colleagues at Valley Medical Center and Michelle Delacaille in particular to wrap around those patients so that the process is started here and followed up in the community. And so that's what we're doing now, but that will be built as part of the discharge planning, identifying those patients on the front end who don't have viable Medi-Cal, making sure that we start the process at the beginning of admission. So that discharge will start at admission. Discharge
and
planning.
I would recommend, just as a semantics point, that we don't say that we don't charge for services.
Yeah.
The reality is we're not reimbursed for services, and just, you know, for the public and anybody paying attention, this is expensive care, and that expensive care is covered by the county general fund.
Exactly.
In absence of reimbursement.
Right. Yeah,
So,
and
thank you for
you're
all.
very correct, Supervisor. And I'll qualify because the patients are here and they have a constitutional right to free care. And so we're not capturing.
We're not charging them, but we are charging, the county is paying for their care.
Right, absolutely.
There's no such thing as free.
Right. So that's why we're not capturing insurance information, but we're going to start capturing that as well upon admission into the facilities.
Yeah, that actually makes a lot of sense, especially if they're on any kind of medical services that are not, I mean, insurance that isn't public insurance. That's a really good point. Thank you. Wes?
Yeah, I admit I came in a little late, so I didn't hear Dr. Davis' presentation. When the jail was a new addition, was years back.
Sorry, Wes. Could you hold on a moment? Dr. Smith, could you mute yourself? Or if the clerk could do that. Thank you. Wes, go ahead.
As I said, I didn't hear the full presentation from Dr. Day, but going back when the new jail was proposed, what, 6-7 years ago, the idea was to make it a 90-day discharge program, as you recall. And I wonder what the new, is the new plan going to follow that? Or, I've heard all these details about things and I think they're great, but I'm just wondering if that's still part of the plan, that the new jail will be 90-day discharge, where people from outpatient could come in to prepare them to leave and all of that. So I thought that was pretty good, but there may be reasons why that can't be done, or will it be done? That's my question.
So Wes, I think that we'll be agendizing a discussion about the new jail to the committee, because I think there are a lot of questions that need to be asked and answered around that topic. I will just say that it was our intent prior to the construction of a new jail to begin that process now, that we weren't waiting for the new jail as it related to having discharge teams. And so some of what Dr. Day covered was what her piece of it is relative to the medical side. But, and actually hearing you talk about that, I think one thing that, pardon me, that my office will do with staff is go through the recommended policy changes, frankly, that have come from this board and the Board of Supervisors, and sort of do a check-in on them, because I'm glad you reminded us all of that. Thank you.
Yeah, I must say I'm a little concerned as a chaplain about the young man that committed suicide the other day. He was one of my people that I had followed, but I had a Christian minister go see him. But he was in a cell by himself, so I was wondering, how did he do? How he committed suicide, and I think that's still part of what I think the jail needs to look at.
Thank you. Thank you very much, Wes. All right, I see no other comments on this. Thank you, Dr. Day. I'm going to move to the next item.
Thank you.
Item 5. This is a report from the Office of the Public Defender relating to the pre-arraignment representation and review team, also known as PAR. I will hand this over to the Public Defender.
Thank you, Supervisor. Today, we're going to have Assistant Public Defender Charlie Hendrickson and Supervising Public Defender Carly Ware presenting on this issue. Charlie, are you there?
I'm here. Can people see our presentation on the screen?
Yes.
Okay, good. So good afternoon, Chairperson Chavez and all board members. We are really excited to give you a brief update on our,
We have a new screen that's up that went from your presentation.
Carly, are you on?
Yes, I'm trying to use technology.
So I've got the share screen up. If you can undo the share screen.
Yeah. Let me know when you want me to share it.
I've already got, I thought I had it up. Is our presentation up?
It was, and then something odd happened. So there you go. It's up.
It's back. We're good. Okay. So we're excited to give you a brief update on our PAR program, kind of updating what's happened in 2021. First, I'd like to introduce Carly Ware, who is, as of this week, the supervising attorney for our expanded PAR team. So that's an exciting development for us. And Carly really is both the brains and the engine behind the program. So I think it would be great for you to hear from her. Take it away, Carly.
Thank you, everyone. It is a pleasure to be here. In 2019, the pre-arraignment representation team at the Public Defender launched. We call ourselves PAR. In 2020, as many of us had to do, we adjusted to the new reality. And in 2021, we really focused on scaling up. So I'm excited today to share with you some of our numbers of what we were able to accomplish just last year. This slide is displaying the lives changed and the individuals affected by our work. As public defenders, we work mostly in the courtrooms to meet our clients for the first time And our team is endeavoring to change that model so that we meet our clients early. Our incarcerated clients are in the jail, and we can meet our clients in custody before court if we use resilience and innovation. We did that in 2 ways in 2021. The first is that we worked with pretrial services and the sheriff to innovate a unique rapid representation model where we use tablets in the booking process to meet our clients right away, immediately after arrest, before they had been housed in the jail. And we were able to meet almost 300 people that way in only a few months. What we learned during that time is there are time pressures and logistical challenges to the booking process that really present obstacles to a quality interview happening by a public defender. And so we pivoted back to the model of meeting our clients in custody in their housing units between their arrest and arraignment. We were able to meet over 400 clients that way in 2021. This slide displays the services that we provide our clients early. These are all things that we were able to do, these hundreds of supportive contacts we were able to do between the time of arrest and arraignment for our public defender clients. And our goal with each of these actions is to not only increase the level of services that our clients provide, but to really improve the integrity of the processes that are in place to instill respect and dignity for everyone that's involved in the criminal legal system, and to really safely reduce the jail population by providing responsible and informed release plans to the judges that make these ultimate decisions in court.
Carly, can you advance next? In addition to working with individuals, and that really is the focus of the public defender's work, is working with individuals and bringing them the best representation that we can. PAR has really taken a hard look at what happens between the period of arrest and arraignment, and has been interested in one of the kind of nice offshoots of the program of looking at some systemic changes. One of the things that we have accomplished is the first bullet point up there, which is we recognized through our representation that many people where the DAs have declined to file charges, they would stay in custody pending a placeholder arraignment date. We believe they were over detained. We worked with our friends at Pretrial Services and the District Attorney's Office, and they changed the CJIC code so that as soon as the District Attorney makes a decision not to file a charge, that initiates the release of a client. That's something new that came out of this program. Things that we're looking at in 2022 would be finally implementing something that's been in the Penal Code for years, which is Penal Code Section 1269C, which provides that people who are in custody have the right to bring relevant release information to a night or duty judge who's making a detention or release order about a person prior to the arraignment. There previously has been no system for having that communication or providing that information to a duty judge or a night judge. We look to change that in 2022, and we'll be partnering and working with our partners over at the court and the DA's office to do that. Another program that we're interested in doing is getting rid of or changing the arrest warrant system by which people are generally brought out of custody before the court, and looking at ways to do that through summons. We think that would help reduce incarceration, particularly for people who otherwise are good candidates to be released. Otherwise, they'd have to be booked. And finally, this is exciting, and this is the part where Carly is now the supervisor of this unit. We are looking to take those numbers that Carly shared with you, where we engaged 724 people last year in the last 10 months of the year, and we want to double or do more than that. We think the best way to do that was to essentially collapse or combine our PAR team with our arraignment team and have them share those duties of interviewing people prior to arraignment and doing all the PAR tasks that Carly showed you that we do, and doing that with the arraignment. So we're going to have 6 lawyers in 2022 working on PAR and arraignment tasks, along with an investigator, social worker, and paralegal. And that concludes our presentation. Thank you. We'll take questions.
Thank you. Let me first go to the public and see if there are any comments. I see no hands raised. I am going to come back to the board, close the public hearing, and come back to the committee for comments. And Mary, we'll start with you.
Hi, thank you for, let me lower my hand here. Thank you for sharing your overview. And it made me think, and I was thinking about something I'd heard about there potentially being another, shortly going to be another 500 people practically a week coming in through the Hall of Justice as a result of different, what am I thinking of? Initiatives and various things. And so I'm thinking about personnel. And I'm wondering, in working with the behavioral health services, particularly the criminal justice behavioral health services, how, first of all, are there enough people to process substantially more people coming through? Do you need help? Do they need help? And because it just seems like, I don't know, it's a lot of people to move through the system. So that's my question.
Mary, when you say, do we have enough personnel to process people, are you talking about attorneys to engage them prior to arraignment in this program? Is that kind of what you're focusing on?
I'm thinking about attorneys, but I'm also thinking about assessors, like how assessing everybody, right?
So that's just such a great question, Mary. And it's really where we want to take the program, because we realize that it's not just the public defender that provides services to our clients, it's behavioral health. It's Office of Supportive Housing, it's substance abuse. And the county pays a lot of money for these different people, entities to provide services to our client, but how do we get them engaged earlier in the process? So we've been talking a lot with behavioral health about that. The new Department 23 court, which pretrial services is standing up, which is essentially the arraignment court. Behavioral health is going to be a presence at that physical presence, that courtroom, to support people that we identify as having behavioral health issues. If we could improve communication systems at the jail, which we are doing through video for the public defender, but it's a little bit limited right now, we think that after we conclude, say, our PAR interview with the client prior to arraignment, and we identify them as having behavioral health needs, we could refer them to behavioral health. And if they could piggyback or get in on a video, then they could provide some service to those people immediately. I mean, these are services that come to people at some point in the legal process. We're just trying to figure out how do we do it more quickly and get people out of the jail sooner with sensible resolutions.
Thank you. Molly? You're on mute, Molly.
Thank you, Supervisor Chavez, and thank you for the opportunity to kind of showcase this early representation. I wanted to mention that on March 8th, Carly and Carson White, who was a fellow from Stanford who helped kind of stand up this program, will be presenting on early representation to all the chief public defenders in California. And I mention that because this is really a novel way to practice that nobody really besides San Francisco is doing it. And all of the other offices really want to hear how to do it. Nobody has ever really practiced this way before. We only ever used to make our first appearance with clients at arraignment. So it's very exciting. And I just really relish the opportunity to talk to you all about it today. So thank you.
Thank you, David.
Thank you, Supervisor. Yeah, I really want to give a shout out to my colleagues at the Public Defender's Office, coming from the DA's office, which you might think would be in opposition, but I can't emphasize enough what a terrific job Carly and Charlie and I'm sorry, I feel like an Oscar winner. I'm now blanking on all the names of the people I want to recognize. But to say, what, it's not just the quality of work is good, it's that they've really shifted the paradigm. And for example, the structural change that came through their observation about the delay between my office ruling that we weren't going to charge someone and that they had a court date, yeah, to be sure. And in many cases, it was delayed by hours, but sometimes it was delayed by days just because of this error in the system. And, they were the ones who figured that out. And in addition, I think, and this is kind of related to what both Molly and Charlie just said, it's a radical change to recognize that in representing clients, it's not just about figuring out what their legal rights are to litigate their case. but kind of looking at them as a whole person and looking at their needs and their community that they're embedded within. And I certainly know my office has begun through any number of programs we've talked about before to think more in that way. But I really think that this sort of innovation is also going to allow us to have more people succeed, both out of custody, before the trial, after the trial. So in the, when this program first came, of course I wanted to work collaboratively, but I didn't have any particular expectations. I think they have just done such a terrific job and exceeded all expectations. So as someone who's watched it from the beginning, I really wanted to pass that along to the fellow board members who maybe don't get to see it as up close and personal as I have.
Thank you. So with that, I'm gonna thank the staff for presenting, and just one request that I'm gonna make is that the program I know this program is being studied by the California Policy Lab, as Molly lifted up there, and I want to make sure that policy paper is shared with the group, because I think it would just be helpful for people to get some richness to it. The other thing is that I am very interested in getting a report that can be on our consent calendar for our next meeting, but to really understand the metrics by which we're determining our success here. And part of the reason for that is that, my initial interest in this program was making sure that that people had really fair access to representation at the earliest point in the process possible. But as we think about what grows and how we grow, part of what we need to ask ourselves is, what's the problem we're trying to solve? Are we solving that problem? Are we learning new things that really do make overall improvements to the system? And if so, what are those? And what's the regular mechanism for reporting back, so that we can determine when a program is effective and how we expand them? Now, just to say to my colleagues on the board, this program isn't even fully staffed. And so the amount of work they've been able to do without being fully staffed is really pretty remarkable. And all that said, they will be fully staffed, we hope, in February, knock on particle board or wood or whatever you're near. And I, for one, am very interested in understanding how the inputs that we have really do impact the outcome of the public safety and justice system robustly, and in a more fulsome way, which I think is part of what our call is on this board. So with that will be my recommendation and request for our next meeting, not for a verbal report, but just a written report that lays out the metrics that you all are recommending we use for evaluation. So we're going to move on to item 6. And this item, pardon me, is going to be relating to current family connections and reunification processes and services offered by reentry. And Javier, I don't see you, but I think that must be you.
Hello, Chairperson Chavez. Can everyone see the slide presentation?
We can. Thanks so much, Javier.
Perfect. So I'll really go quickly on this item. So this is just an update to the reentry network governance in terms of our findings and our research on family reunification, family finding with our providers. And then at the last slide, we'll be providing you with some recommendations on how to improve the process of working with our clients. So just some types of services, just a little bit background in terms of what we mean with family finding and family reunification and who is doing what services. So many of our providers are navigation providers. We have 3 contracted with Officer Reentry Services. They work with the clients in terms of the intake and enrollment, and they're asking them about their clients, whether it's at the jail, at the court, or at the Reentry Resource Center. So wherever they are connected to with our service navigators. They will then identify that as a goal for the client, and then they'll start referring them to various services. So we found multiple services that they will refer the client to or help them access, like here at the center, Uplift Family Services and Family and Children Services. And so while we understand that family reunification is a valuable service, it may not be the most important service or need by the client up front, but it might be during their journey in terms of their reentry services. So it could be within months or later in terms of engaging. And so we make sure that all of our service navigators, contractors are aware of services that they could refer clients to and provide them with warm handoffs. One of the plans that we had years ago that we incorporated with our CAPS process, our community awaiting placement supervision, was with OMOS in terms of making sure that clients, if they needed some mitigation services, we worked with the Office of Mediation and Ombud Services with the county. And so we jointly created a form, and that was a supplemental attachment to this item for the committee to look at. But it is a form that our providers will use in talking to the individual. We also share that with all of our providers, not only our service navigators, but also all the other providers, and then with other providers that work at the Reentry Resource Center. So in essence, it's a form that the case manager, client navigator, peer mentor, community worker can engage the individual in terms of connecting with the client and having OMOs doing that connection with them. And so that's something that we did look at. And then with CAPS participants, when we did the research, it wasn't utilized as much as we had hoped for, but we're looking forward to expanding those efforts, perhaps revising the referral process and ensuring that all of our providers are well up to speed in terms of using this form and having those ongoing trainings. And so, I was glad to hear Carly earlier talk about the PAR and rapid representation. And I noticed on one of the slides that the 724 clients, 418 were connected or were helped them connect with families. And so our focus has been with our CBOs. So here in that presentation, I think our next step is also look at our existing county staff, because county staff, whether it's the attorneys, paralegals, behavioral health staff, are connecting to clients with their families. So I think our next role is try to engage with the PDO to say, of the 418 clients that you help communicate with families, what resources did they get linked to? Were they some of the ones that we've listed here? What did they use OMOS and so forth? So my next step is to reach to Carly and the PDO and behavioral health department to see what staff are doing to engage clients with families, because our focus has been our providers, our contracted providers. And so then not only do we want to provide trainings for our community providers, but also for our internal county staff. So that's something that I just glimpsed and want to make that recommendation as this discussion was moving along. And so lastly, we had talked about support groups. So we do let our clients know we have a peer-to-peer support group here offered bi-weekly at the Reentry Resource Center. Behavioral health has many peer-to-peer support work efforts. The faith-based centers have a lot of peer-to-peer groups. So now we just want to make sure that they are aware of these connections. So when an individual is talking about ways of connecting or reunifying with their families, they have a resource to refer them to. So with that, I'll end the presentation, and then I'm open for questions or comments.
Excellent. I'm going to look to the public to see if we have any speakers. I see no hands. I'm going to go close the public hearing and come to my colleagues, and I will, before I turn it over to you, Supervisor Ellenberg, I do just want to say thank you, Javier. This is a program that we've been trying to get up and going again for years, and then COVID happened, and then all the other issues. But I really appreciate very much the idea of working with other departments and kind of getting out of our silos and seeing what training is necessary to make these connections. I also just want to request that we engage NAMI in our as you get into this next phase. And colleagues, I'm going to be asking that the staff report back to us in 6 months once they've got their feet under them, just to better understand the program implementation. I know it's still a little bit rough, but and also Javier, to you to think about other partners, both within the organization, which I think is fabulous, but also We did have a contract with NAMI for a while to help us with connections with the jail. I don't know where that contract is or whether or not it needs to be revised, but I think it's worth us taking a look at that particular group. Supervisor Ellenberg?
Thanks so much, Javier, and your comment really exemplifies, I think, the importance of cross-department committees and work groups such as this one. I'm glad that you were able to get additional information today. The piece that I'm curious about with family reunification is if parents, particularly single parents, have lost custody of their children while incarcerated and they are unhoused. Having housing is often a prerequisite to regaining custody. I know it can be particularly hard for people coming out of the system to get into housing. Is that one of the supports that we provide, and how successful are we?
We could ask our service navigators if they've worked with clients in those situations and get back to this committee as part of our follow-up report. I think it's important to know that, we do work with Family Children Services and DFCS, so it's getting that information. And then we do have an organization called Pro Bono. It's our legal entity that is contracted with Office of Reentry Services, and they provide legal information in custody. So we've started doing those workshops in custody, and they're also here at the Reentry Resource Center. So we could follow up with our legal team, Pro Bono, Silicon Valley as well.
Thank you. I really appreciate that.
And then thank you. And then Supervisor Chavez, you mentioned NAMI. We did last year when we did the survey, we attempted doing the survey. We got some feedback, but there was a technical mishap on our end getting NAMI's input. So we'll reach out again with NAMI and redo that survey.
Excellent. Thanks so much, Javier. Wes? Supervisor Ellenberg, were you done? Great. Thank you. Wes?
Couple of things. Javier, thank you for your presentation. However, I do wish you spell out those acronyms, ORS, OMRS, and CAPS. I don't know what they mean. The other thing is, if you want partners, why aren't you going to the chaplaincy? I think we have a strong part that goes on in the jail for reentry. I do know that two of the guys that I see have been in there for 12 years and they're finally going to get out. But 12 years is unacceptable to be in jail before you go to court. And so we can, and in terms of this young man who committed suicide, he can't find his family. They don't have any contacts outside. So these are concerns that I have as a chaplain to see these things. And we can help in your partnership as well. So I didn't hear you say that. So chaplaincy is a strong part of what goes on in the jail, because I've been there for 13 years and I see that happening. So just a comment.
No, thank you, Wes, and we'll work with our partners at the Sheriff's Program Unit to see how we can work with the chaplaincy. And then for the acronyms, yeah, I do apologize. So ORS is Office of Reentry Services, and CAPS is the Community Awaiting Placement Supervision.
OMRS?
Oh, that's the yeah, the Ombuds Mediation Services that's under the County Executive's Office.
Okay, thank you.
Thank you. We'll make sure we're scrubbing for acronyms and also making sure we're putting out the definitions. I think that's actually really great feedback. Thanks, Wes. And thank you for the feedback about the chaplaincy. Thank you. All right, Javier, do you have what you need?
Yes, I do. Thank you.
Great. Thank you very much. We'll look forward to that next body of work. All right, we're going to item 7. And this is mobile phone applications for criminal justice clients. Go ahead. I'm not sure.
Go ahead, Supervisor.
Oh, no, that's right, Key. I was just going to hand it to you. You were all ready to go. Excellent.
Okay, thank you. Good afternoon, supervisors and Reentry Network. My name is Deputy County Executive and I'm joined by my colleagues from the various departments who are here to answer any detailed questions that you might have. The last report was actually in October of 2020. And in that report, you may recall that the Pretrial Services Department had an application. The Office of Reentry Services, Public Defender's Office, District Attorney's Victim Services Unit were in the process of working with TSS to possibly submit a proposal to develop applications. The Probation Department and the Sheriff's Office were contemplating a possible application. And then the Custody Health Services was not. Today, I'll be providing a brief update on the various mobile applications. The first is the Office of Reentry Services. At this time, the Office of Reentry Services is holding off on developing a mobile application. While there's some concern about costs, I think the main reasons are that first, the Office of Reentry Services, while it does contract for some services directly, it's mainly a facilitator, coordinator, connector to a variety of services that the county provides. And so, possibly creating an app that provides reminders to those services may be duplicative. You may have seen in your report an example of that is the Social Services Agency has an application called Message Minder or Message Media that does provide frequent and regular reminders. And then the second reason is that maybe the focus for Office of Reentry Services should be on providing or trying to give access to the basic tools. Many of the clients who come to the Office of Reentry Services don't have mobile phones, they don't have useful email addresses. So it's a little bit of a question of priority and sort of the effectiveness and appropriateness of a mobile application. The Public Defender's Office has made great strides. They've been partnering with Stanford and TSS. They have launched the 2 phases of their application, which provides reminders of court dates. They are able to provide 2-way messaging. And the third phase is to try to coordinate Lyft rides for their clients arranged by the attorneys. The Office of Pretrial Services has had a mobile application for quite a bit of time. It provides 2-way messaging. It also provides reminders about court dates and drug testing dates. It does allow for remote check-in. They've been actually working on 2 enhancements. Apologies for the typo here. Those 2 enhancements are one, testing the testing the application on an Android platform. Right now, it's just iOS. And then the second is working to try to enhance the language capabilities, providing the application in Spanish and Vietnamese. Once those are fully complete, they'll be working on providing more resources into that diversion tool, and then also converting some of their conversations that the pretrial services officers are having with clients on the mobile application, and basically converting that, downloading that on a daily basis to cut down on sort of data entry requirements. Finally, the District Attorney's Victim Services Unit, they have been testing a mobile application, and it should be fully deployed around the end of March. Currently, it provides individuals with the status of the case that they're involved in, information about who is the assigned district attorney, who is the assigned victim advocate, and also provides them an updated status on their application for assistance. And then last slide is just some of the lessons learned. I think 2 things here to highlight. One is that, for the populations that we're trying to serve and assist, it is a pretty iterative process to make sure that the applications are usable, useful, and appropriate. And then the last is that across all of our departments, we're finding a need to look at how to address language barriers. And that is something that we're looking at, not just for the mobile applications, but of course for our online presence as well. With that, I'll pause, stop sharing my screen, and be available for questions. Thank you.
Thank you very much. I'm going to see if there's any members of the public who would like to speak on this item. I see none. I'm going to come back. I'm going to close the public hearing and come back to our committee. I do just want to make one observation to my colleagues. You may recall that this was a body of work that we requested, I want to say maybe in 2019 or so, to try to take a look at, maybe 18, to try to take a look at how we could combine our resources across departments to figure out how best to provide services relative to what people may or may not have with their phones, and making it easier for people to keep track of appointments and the like. I understand Keith just inherited this program like a month ago. So again, this is not a reflection on the work. I actually really appreciate you breaking this down so clearly for us. I would like to, in addition to making sure that we are covering all of the materials so that they're in at least Spanish and Vietnamese as soon as possible, I think is important. What I would also like to recommend, Key, is that there be a cross-department working group to determine whether or not we should be doing any broader RFPs or RFQs, and frankly, trying to prioritize through TSS any of our programs, especially based on the new bodies of work that all these groups are undertaking, which was, so that we would have, so that we're better able to leverage technology, and if everybody comes back and our hands are thrown up because there's no way for us to collaborate, then what I would really I'd like to better understand is what are the mechanisms we're using to determine whether or not something is effective. I am concerned, honestly, that people are all starting their own things, because I'm worried that what that means for the poor client is for every navigator they have or every department they work with, they're going to have a separate app. And I think that's the wrong direction, incredibly the wrong direction. All right, so with that, Wes, and then Judge Manley.
Hi, Key. Good to see you. Did I hear you say that one of the applications is to provide transportation for reentry?
Yes. One aspect of the public defender's application is to coordinate Lyft rides, and Assistant Public Defender Sarah McCarthy is also on here if there's you need more information about that.
That's a key. That's a key one, because so many that I know that didn't have transportation to housing or places where they could go, that spells recidivism right away. So I think that's a key thing. Thank you for mentioning that. I appreciate that.
Thank you, Judge Manley. You're on mute, sir. Judge Manley, you're on mute.
Okay, there we are. Key, I just wanted to raise an issue that I see every day. It's very practical. I am so, to me, the using these apps is really, really helpful and effective. But the bottom line is you have to have the phone to put the app on. Now, what I hear every day from the clients, if you're homeless, your cell phone's going to be taken 3, 4, 5 times. If you get out of jail, you're not going to have a cell phone necessarily. You're not going to be able to have a laptop. And I know this not only from listening to them every day, but when we do our remote hearings, which we're doing now, using our platform in the courtroom to reach people where they are out in the community, we have this same problem. So what I would like to know is, what data do you have on the availability of cell phones to all the clients that we're releasing from custody, and how many of them are able to keep the same cell phone? I mean, every day we are having to get a new phone number because the individual had to get a new phone And I'm not at all sure whether the application that would be very helpful to that client has been downloaded, or that the client even knows, how to do that. So that's the concern I just raised, because I think the application, and Supervisor Chavez is so correct, giving multiple applications to individuals who have limited ability to understand technology, let alone access, to me, is the worst thing to do. They need to have one that really works and helps them with those critical issues that they need help with. Thank you.
Through the chair, Judge, thank you for your comment. That was the principal issue that the Office of Reentry Services raised. Don't have the data, the information that you're requesting at this time, and maybe we can go back and confer with our colleagues to give folks a sense of the scale of that particular problem. I also see that Sarah McCarthy has her hand raised, and I don't know if she wanted to add to this part of the conversation.
Thank you. I just wanted to offer briefly a couple of comments that may be responsive to some of the questions you raised, Supervisor Chavez or Chairperson Chavez. I think a cross-department working group is a good idea because the county doesn't want to have a lot of redundancies. And I would just say the project that we're involved in with Stanford is building this app for us and has worked collaboratively with us in building it. But they're building it in such a way, it's an open source kind of software platform, and they're building it in such a way that we take ownership of it after, they stay involved for a couple of years, and then it becomes ours to own and manage. And there's no reason to think it can't be shared across the county and used by different departments. In terms of mechanisms to measure the effectiveness, that's an important part of the project we're doing with Stanford. And part of what they're doing is studying outcomes. So using the data, they're running experiments, and hopefully there will be some published studies that come out at the end of this. But to see, are we reducing failures to appear? Are we reducing bench warrants? Are we shortening the length of criminal cases and so on? So we're definitely aware of, wanting to ensure that this is having the impact and the effect that we speculate or think that it may have. And finally, to the point about separate apps, I just wanted to say, at least in this app that we're using, the app is installed on our side, on the side of the public defender's office, so that, for example, an attorney could use their personal cell phone and not have to reveal their personal phone number to the people on the other end. But on the client's end, it's just coming through as a regular text message. So there's no additional app that's being installed on the client end. So it streamlines it a little bit. I recognize that every department may have different needs, but again, if this is a tool we could share across the county, the app may not need to be on both sides, depending on what the need is by the department. So I just wanted to offer those because we've been really kind of thinking about this and exploring in this process for a couple of years. And if that's helpful to others, I just thought it might be useful to put it out there. Thanks.
Thanks, Sarah. Appreciate the information. Rose, and then Pablo.
Yes. With the cell phones, a lot of the clients that come to our day workers center, they don't have a way to charge the cell phones. So they can't even access anything until their phones are charged, because there is any place for them to charge them publicly. And then the other thing is, some don't even know how to access a message, a text message. And so that also creates a problem and a barrier. And I remember one of the other discussions was that in the unhoused community, they'd have to leave their possessions behind and their animals, their dogs or cats or whatever they have, in order to appear in court or to attend these, whatever it is they have to go to. And again, they're very attached to these animals, or definitely their possessions. So it's something else to think about.
Thank you so much. That's all good points. Pablo?
Yeah, I just wanted to just reiterate. I know that we talked about this, Cindy, a couple of years ago. We kind of got together and we had an idea around how to take some of the limited resources that we have, prepare an app for the folks that are navigating the system, and then really use the aggregate data down the way to figure out and really make safe bets on what success looks like and the key factors that kind of come about it. All that talk was kind of out of my scope at the time, but starting to understand that, I'd really be interested to circle back with. I didn't remember the lady's name who just spoke. Was it Sarah?
Yes, McCarthy.
I'd love to talk to you, Sarah, about that. And Key, I have some key points on that as well. I feel like across all of our agencies that there is a way that we can not only build the app out so that it is feeds into from different sources, things like court dates and appointments for probation and all of the necessary things that a person would need to do. But like I said, on my smartwatch, I get goals every day, and sometimes even though I don't feel like going for a walk or I don't feel like doing exercise, my watch will remind me and tell me, hey, you only got 750 more steps and you'll reach your goal. So I'll go out and I'll do those type of things, right? So if we can take from it a way that we can do it so that it's like encouraging and rewards and things like that, I think that it would be not only beneficial but a way to kind of help people get connected to other things. The second point that I wanted to make is that there's dollars out there from a federal capacity that are doing like lifeline phones. There's tons of providers. I don't think that it would be too far of a stretch for us to figure out a way to bring in individuals that can prepare those phones for folks right when they come out of jail. I mean, it's looking at the way that the funds are kind of distributed and how those providers are able to do it. But ultimately, in one form or another, the money's coming from the same source. So if we could think about the ideas around how to, one, get people a phone right when they get out, two, have it already preloaded into the application, and everything from navigation to locations, goals, and all of those things that are already built into the app, that's one more thing that will get them going. So just my thoughts. And when it comes time to start developing and looking at how it's really going to go, I'd really like to be a part of that. So please reach out. Thank you.
Yeah, thank you for that offer, Pablo. That's really appreciated. All right. Thank you all. It was a good discussion, Key. Appreciate you bringing that work forward. We'll look forward to seeing a report back. What would you say in maybe 6 months on the language and also on the integration? And I would just ask if offline or off agenda, even if it was just via email, if you could let us know if this needs to be prioritized in the TSS work plan. And I really just want to encourage you guys to come up with an ongoing working group till this gets kind of settled, because I do feel like we keep handing people lifelines, but we're handing them so many, I'm not sure they know which one to grab onto. And that includes with, different apps and the like. So if we could take a look at that, I think would be really great. So we'll look forward to that in 6 months, give you a chance to digest the fact that you got a new project. All right. We're going to move on to item 8, and this is a report relating to minimizing bookings for individuals who remained in custody for 3 days or less. And I think Miguel is leading us in this discussion.
Yes, thank you, Supervisor. And I think Melanie is going to share a PowerPoint presentation. I think we have 8 slides, and I think the first one begins with Melanie.
Thank you.
Thank you, Miguel. Good afternoon, committee members. So as this actually follows a conversation we were just having, as we talk about leveraging technology and data, that is something is still evolving in our shop, as well as we look at how do we collaborate better as a team and start with the same kind of fundamental understanding of the problem that we're trying to address. So this data is following up on what was presented to you a year ago, almost exactly, where we were really trying to take a deeper dive and get our arms around what data was out there and available to us. So this is now tacking on 1 more year. So we have 5 full years of data that predate the pandemic, but we have 2020 and 2021, which are still anomalies for us, and we're still working through those. But the reason why I wanted to give this kind of historical perspective is because a lot of the people who are on this network also know that a lot of the criminal justice reform work predates the pandemic. And so a lot of those efforts started to start bringing down the population, but there is no turning away from the fact the pandemic was the big turning point for us where things started to change. And we have also kind of reached a stable level. If you look at the total averaged amounts for both 2020 and 2021, we are pretty similar, even though we have been continually working collaboratively to address the population numbers. You can see that even when you look at it from a monthly perspective, those numbers are staying pretty steady. And one of the reasons that we've been able to do that is because of some of the efforts you've already heard today in the meeting, with having better collaboration about those who are coming into custody and finding the information early from the PAR team about how we can find treatment and service options on the front end of the process for individuals to safely get released. So those are just some of the issues that we're working at, but we do know that as of February 1st, the in-custody population was back to 2,504. And I want to highlight that because one of the things that we want to also convey is that this isn't analysis that's happening in a vacuum in a one-time shot. For us to continue to maintain a low population and to try to reach our target of 2,000, it's going to take ongoing work and ongoing evaluation, because 70% of our population is released within 3 days or less. So they're cycling out of custody and new folks are coming into custody. And then there's an additional 10% that are being released within 4 to 10 days. And that is a significant data point for us, because there is something at booking that has them flagged as needing additional services, additional information, additional connections to the community that could make that difference, whether or not they are safe to release into the community. And we all know that 80% of the population is going back into the community in a very short time frame. So we want to continue to expedite those efforts as we have been doing over the last year. And we've seen a lot of progress, but one of the areas that this group talked about last year was also the use of bail. And we're still seeing that about 200 individuals a month are utilizing bail. And the 20% that remain in custody are both sentenced and unsentenced. So if they remain in custody, we know that they have the serious offenses, because we're making recommendations for release for all of the low-level nonviolent offenders. So those who are remaining in there are staying for a significant amount of time based on their risk assessment tool, because our priority is to ensure public safety and to set individuals up for success if they have community connections to additional resources. And so the no bail amount continues to limit the population that we can recommend for release. And in the report, we took a snapshot of February 1st, and that no bail amount was at 52%. So that's 52% of the population where we don't have that option to help have them removed from custody. So one of the areas that we are doing is working with our pretrial services department to look at people on an ongoing basis rather than just at the front door. So Director Matt Fisk can take you through how that data has changed over the last few years.
Thank you, Melanie. Good afternoon to the whole reentry network. My part of the presentation is very brief. If we went back 10 years, you'd see that the pretrial in community supervised population was about 1,000. And last summer we tripled it. We had about 3,000 cases or people. Right now it's kind of stabilized through a lot of efforts, especially great thanks to the PAR team, meaning the defense counsels, the district attorney's office, and the court. But it's unprecedented that we've been able to actually flatten the pretrial client load, because since 1969, it's only grown. I think there was one dip, and that was with Prop 47. So it's a good thing that we're able to take the client load in larger kind of cohort groups to the court more promptly, to sometimes give them an own recognizance release because they've complied and performed very well in pretrial supervision, and other times getting them into court so they can resume compliance because we might have concerns about their behaviors. Go ahead and go to the next slide, Melanie. So as you can see, this slide shows 3 years worth of data, and it just is basically saying that the client load has grown. There's not a lot of seasonality. What we see are different kinds of crimes during different parts of the year. for example, there's probably more DUIs in the summertime and more domestic violence cases in the winter. Not sure if that's true, but that's just an example. So relatively stable at this point. The greatest growth was, as Melanie said, with the pandemic, where it shot up very quickly. Basically, about 1,000 people shifted from the jail to pretrial supervision. And what we saw, the greatest increase for us was the number of clients that were on electronic monitoring. That's really what enabled a lot of those clients to be able to be safely released to our supervision. Okay, Melanie, I think you can go ahead.
So this slide is putting together those who were released on pretrial supervision and those who remained in custody. And the reason why we wanted to give this kind of bigger picture of the population is because this is the kind of the total group of those who are considered justice involved. This isn't the people who were determined to not need to be booked into the jail or who were simply cited out in the field. These are the people who had to continue to be supervised either in the most stringent environment, which is in the custody setting, or through pretrial supervision. And we have been able to see from 2015 to 2021 a 5.22% decrease. And that alone is because we've had progress with partners working together to determine where is the best place for people to be successful as they move through their criminal process. And if you look at this, I like having the colors because you can actually see the shift from blue to green as people move from the pretrial, which PTS, pretrial services, they move to the blue from the green. And that's efforts that we started really rigorously throughout the pandemic, but we're trying to now maintain this level and to continue to bring that down, because we know people are going to continue to be involved with the justice system, that it's how do we then place them in the safe supervision level that is going to allow them to work through their current cases and remain connected to their community and their stable community resources. And we've been able to achieve this because we're looking at data in real time. And so Director Fisk will walk you through some of the updates we've made to the dashboard that you saw 1 year ago.
Thank you, Melanie. I'd just like to point out that if we went back a few more years on Melanie's last slide, you'd actually see a much larger client load, probably closer to about 6,500 people at any given time in the system. So it has experienced a significant decrease, and that's thanks in great part to the district attorney's office for choosing which cases to prosecute and which cases to divert. So rather than entanglement, we of course want to engage the people that need to be engaged in our system, but not entangle those who don't. So that's some great progress. This is what's called a Power BI. We talk a lot about dashboards. Excited to share that with the support from County Council, Office of Privacy, and TSS, we've been able to build about 10 dashboards that are dynamic, meaning that they feed from the raw data source real time, and they're visualizable. What I mean when I say that is if I were to click on, and I could do it, but I don't know if that'd be permissible in a public meeting because while I have the same graphic, it will change. If I were to click on Latin X, it would change all of the other figures. This dashboard is helping us to understand not just the most recent status of what's happening to date, but the historical. So it's gone from a two-dimensional fashion to a three-dimensional fashion because we discovered that we actually had data warehoused, most of the fields in CJIC and other systems going back about 10 years. So thanks to TSS for that. So I'd just like to emphasize something that I find really important. With a shared consensus-based data set, which may have some inaccuracies and some limitations, we're at least looking at the same page, and we can always measure from there. So if something's inaccurate, we can always see a decrease or an increase, and then notice it. We put this out there for all to share, and we always look at the left side of it because it talks about the demographics. We, as Dr. Smith has said, we want to make sure that we're not hurting the most vulnerable in the community with these steps that we take. So you can see the number of individuals, the genders, the age groups, and the ethnicities on that side. And when you click on one or more things, it will narrow the slide and change all the numbers. You can do an export, so you can actually have names and identifiers, but we've only shared this in the aggregate for research purposes. And so far, it's been very helpful. It's helped us to, I don't know if you can see behind me, but my wallpaper is actually a map, 2 system maps that all the partners have joined together to design. And it shows starting with through a victim's eyes, then a client, then law enforcement, custody, health, sheriff's office, through the perspectives of each system partner or participant, each and every decision point and service point in the system. And so what we have been doing is sharing this data, and we're starting to use this map to plot where the bottlenecks are, where we can make improvements. Right now, I have a current map and a proposed map with some pilots that we hope to do. So data, maps, and pilots. And I think that concludes my part.
Thank you. So this final slide breaks down the county's overarching goal of minimizing those in our community who are incarcerated while also maintaining public safety. The next immediate numerical goal has been to maintain a census as close to 2,000 as possible, in accordance with our public health department's recommendations relating to COVID. But even when we're able to achieve that goal, we will continue to work to minimize the jail population even further as much as possible while maintaining public safety. The goal of minimizing our jail population has been a work in progress for many years now. Where we once had a population well in excess of 4,000 inmates, we are now hovering around 2,500 individuals in our facilities. The 3 goals shown on this slide were first presented to the CCLEM in December. In short, we will be seeking to reduce jail bookings by working with our law enforcement partners in the field to promote alternatives to bookings, connecting those who need services with those services rather than booking them into the jail. We are also seeking to reduce the average daily census by improving timely releases of individuals, continuing to build on our pretrial infrastructure, and as Mr. Hendrickson noted earlier, front-loading services wherever possible with programs like the PAR program that you heard about. And finally, we hope to decrease recidivism by using strategies like electronic monitoring that keep people in community, and by better coordinating releases from jails to ensure needed services are provided to reduce recidivism. We've made good progress ensuring timely releases for low-level, nonviolent offenders who are typically released within 3 days. As you heard earlier from Melanie, these individuals account for about 70% of those who are booked into the jail. In this coming year, additional focus will be placed on those who are typically released within 4 to 10 days. That's another 10% of the jail population, with an emphasis on connecting individuals with the services they need to ensure a safe release to the community as they await their court process. So with this summary, we are happy to answer any questions the network may have. Thank you.
Thank you for that presentation. I'm going to first go and to see if there's anybody in the public who would like to speak. I don't see any hands. I'm going to close the public hearing and come back to the panel. I'll start with Wes. You're on mute, Wes.
CCLEM and PAR, what do they stand for?
I always get CCLEM mixed up. The PAR is the pretrial arraignment team that we just heard in the previous presentation. And the other is our community oversight board. Go ahead, Susan.
Community Corrections and Law Enforcement Management Committee, CCLEM.
Yeah.
Community Correction Law Enforcement Monitoring. There you go.
Versus OCLEM, yeah. God. Too many clems there.
The other question is, a lot of you have talked about the electronic devices. Is there any other services that are things you provide to make sure they're, they get community resources or anything? I was curious about that. But a lot of it is obviously a major part of it is the electronic device. But is there any other program?
Wes, I'd be happy to answer that quickly. I always appreciate your questions. So we have started something for that group that Melanie, mainly for the group, really anybody the judge orders, but it's typically the individual who's not released right away. They might be released between 4 and 10 days. And so a support worker picks the person up from the jail, brings them to pretrial. We give them an intake. We give them the electronic monitoring device. And then they're taken over to reentry where they have clothing, vouchers for food, transportation, and housing, kind of immediate needs, along with the mobile medical unit. And then they can also return for more permanent service linkage, like housing and employment, that sort of thing. So far, our cohort consists of about 40 people. And I'll just say we've had some real successes and we've had some limitations as well, but it is improving as we go. I'll be happy to report up on that later.
It's helpful. Thank you. Thank you.
Thank you. Susan?
Thank you so much for this report. Matt, we can't see your video. It looks like it's on, but it's black, and I'm super curious to see the maps.
Okay.
So if there's a video issue, if you could send them to me, I would love to see those.
Sure, I'll be happy to do that.
And two other quick questions. Miguel, I liked the next steps map. Thank you so much for that and for really outlining the work. I'm curious to know if this work is happening internal to the county departments, or if it's also at this point involving CBOs, faith groups, other external partners that could potentially provide alternative services for people that are awaiting disposition of their cases.
It's always involved both. We invest heavily in many contracts through ORS and through other departments to contract with community-based providers. So yeah, it's going to be an effort that involves both. That said, I think we've had so many different efforts along the way that we haven't been as well aligned and coordinated internally. So we're doing work here as we try to build some resources here internally to the county executive's office so we can better coordinate the work. I think we will always rely deeply with our community-based partners, but we want to have a more strategic approach internally. I think the point made relating to the applications is spot on. We can't have 10 applications that you need to download and a password and this and that and the other thing. We should try to make it simple. And I think that's true of service delivery generally, where, somebody said, what I thought it was a really good line, there's so many lifelines to grab onto, you don't know which one to grab onto. And that's a real thing. So we are working hard to better coordinate and align those efforts, and that will include our community-based partners. Absolutely.
Thanks so much. And I'd like to make sure too, as the Alternatives to Incarceration work group gets started through PSJC, that we are not, duplicating or running counter to any of the work that's going on. I want to be, part of that coordination of efforts and make sure that that we are truly moving in the same direction without stepping on each other's toes or being redundant. And I think it's really exciting. I'm glad to see the county executive's office expanding the work there. And I just want to coordinate it with what we're looking to do through public safety and justice so that we can further support that work as well.
Yeah, we always say we want everyone rowing in the same direction because we are rowing in many ways and we want to row in the same direction.
And one thing I would say, Susan, is that at some point as these other processes are going on, it may not be bad to report them out here, just because of the folks that are around this table. So thank you for that. Absolutely agree. And just a final point that I want to make about, I understand that 3 days sounds short, but I'm thinking particularly about parents, and 3 days can really be an eternity in terms of what happens to your child. So if we are looking at populations or prioritizing who we can really move to the no entry, if they're going to come out in 3 days, there's certainly no more of a safety risk if we can get them back to their families and their kids on the same day. So that's just a piece that I want to be in the heads of all of the players as we're thinking about what 3 days means relative to different populations. And thanks all. I think the work is really exciting. It's really progressive, and I'm looking forward to seeing us do more. Thank you. Erin?
I wanted to both acknowledge the progress and the good work, as Supervisor Ellenberg said. it really encouraged by the commitment in terms of reducing the booking and kind of the folks getting booked in and the short stays. And I was wondering, one of the consultants at some meeting that was held relatively recently was talking about a deflection center. And we've had some conversation about a booking protocol, both of ways of kind of to keep people out who don't really need to be in jail. And I'm just wondering if there's been further conversation about that.
Erin, let me jump in there and then I'll see if staff wants to weigh in. I think that was actually raised by Supervisor Lee when we were having the discussion about the jails, and actually one of the staff used that as an example. I don't think we know enough about what that is or isn't. And my expectation is that through the working group that Susan is leading through public safety and justice, that will be further discussed. I will also say that on our end, you know, I've been talking to Dr. Smith and I had not yet had a chance to have this conversation with Miguel, but I'll just sunshine it for all of you that I am very interested in taking a look at the reentry center to see what its next iteration is going to be, along with the recovery station that we have attached to it, because you know, again, some time ago, we started to think more about the reentry center having a no entry option, a real one. And some of that can be done programmatically. Some of it requires perhaps even a new structure. And then a lot of it, my observation is really tied to the work that is happening with behavioral health and the adult behavioral health system, and really being able to integrate all of that in. So what I'll say is on that front, Erin, I think there's more to come, and that everybody's pretty interested in learning about what we can learn from other places, and then seeing where we have foundations that can be changed or where we need to do things dramatically whole cloth different. So I'm glad you raised that, because it was something I meant to talk about at the beginning of the meeting. Thank you.
Supervisor, if I may weigh in, just from the administrative perspective, I completely agree. I think as at least I think with the issue and as the work that I'm leading, this issue is so important and it's so complicated that no idea should be taken off the table. We need to really vet it carefully, really think about how it aligns with all our strategies. I don't know enough about a deflection center yet. I did hear from Supervisor Lee in that conversation. So we will look at it, vet it, make recommendations, and you know, thanks for sunshining about the reentry center. I agree with that, and we need to expand our efforts there. There's no question, and that's something certainly that we're in the midst of working on.
Yeah, and I think one of our challenges and opportunities is going to be to align this with the work that Supervisor Allenberg is leading, because all of this will need to happen concurrently. All right, so our last item, thank you everybody, thanks staff for that report. Our last item is item 9, which is a report from the Office of the Sheriff relating to the gender responsive assessment at the jail. And this is a long-awaited report. I'm really excited to hear it. And I think, Lori, Sheriff Smith, you're going to lead us through this.
Yes. So first of all, I know that this is something that's been near and dear to your heart, Supervisor. You started this many, many years ago, and we're so glad that we can present it now. I'd like to make a few introductions. First, Captain Pageant is here and Captain Duran, and they'll be here to answer any questions. And we're really happy to be bringing this forward, and it's been a pleasure working with the Moss Group. Individuals from the Moss Group will be making the presentation and will be available for questions. So I'd like to introduce Tina Waldron and Katie Cummings from the Moss Group. So thank you very much, and we're here for questions.
Excellent. Thank you, Sheriff. Thank you so much.
Thank you so much, Sheriff Smith and Chairperson Chavez. If I could just grab a minute here, I will share my screen. All right, so I believe you all can see my screen now, is that correct?
Yes, we can, Tina. Thank you.
Perfect. So we just want to first start out by thanking the Sheriff's Office, as well as just the variety of partnering agencies and organizations and community stakeholders that we were able to speak with, the Reentry Network and all of the staff and women who live at CCW. One of the things we said early on in this process is that our report and recommendations can only be as good as the degree to which people are willing to teach us about their facility. And we had a just excellent experience. People were so open and candid and willing to share strengths, but also the things that might be challenging or that they had ideas about how to make better. And so from our perspective, that's the best way to start an assessment like this. In earlier calls, we had talked, oh, of course. In earlier calls, we had talked some about the foundation of research that is sort of the underpinning of our work. In the PowerPoint I submitted, there are a handful of slides that describe that, some of that foundational research, and it provides information on a couple of good articles if you would like to read those. I won't go through all of that here today, but I'm certainly more than willing to answer questions or have a larger discussion at some point. So now let's get into the report. A few things that provide context and purpose for this report. One is that it's important to know that the report and its conclusions and recommendations do represent a snapshot in time. So these are the themes and recommendations that emerged at the time of assessment. And we know there's some things that have moved forward. For example, at the time we were there, the tablet process or the tablet availability was still in pilot, but I understand that since then, those tablets have become more widely available, which is something that you'll see throughout our recommendations. It's also important to know that this report includes a process of fact checking. So the Sheriff's Office had their team review for any factual corrections or errors or clarifications that needed to be made. And we really appreciated that discussion. It was a very thoughtful discussion and definitely made the report stronger. We were able to clarify a couple of factual errors that we had in there. Dr. Day and her team are also reviewing based on those components of work where she and her team collaborated with the Sheriff's Office in this process. So we'll continue to have that conversation with her as well. It's also important to know that while this report and assessment was really designed to address agency and facility specific strengths and challenges as it relates to work with women, the community support in your county and in your area is so strong that we were really able to also take a look at some of the system strengths and challenges and make some recommendations in that vein as well. And everything that we put forth definitely is overall an approach to strengthen what's already been implemented and make sure it's sustained, as well as implement some new systems and processes. We see our reports as not a checklist, and I think that's important to say, but as a foundation to really sit down with, look at the context in the facility and the community, and prioritize the recommendations that are in the report. This is a very iterative process in terms of building a gender responsive system. And so rather than looking at it as a checklist, I really encourage you to look at it as a process that can be built out across 2 or 3 years. So there are a few foundational strengths we wanted to talk about before we jumped into recommendations. First of all, it became very clear to us very quickly how very well respected the CCW leadership is in the community, by staff, and by the women who live in the facility. It's something that we heard early and often, and I think that is one of the reasons that both staff and the women in the facility were so willing to candidly talk with us about just, where they live and where they work, what's going well, and what could be better. Also among staff and leadership and really in relationships with community providers, we saw a lot of respect and camaraderie and willingness to collaborate. I would say especially from the community to jail side, I heard in this community more than I have almost anywhere else, maybe anywhere else, that there are positive collaborations and that there is an openness to collaboration. There are, of course, ideas to make that stronger, which we can talk about, but that was very apparent from early on in our process. We also know that while we're talking about implementation of gender responsive practices, there are some positive and effective practices that are in place already. And we give you guys some examples here. After action review process is really strong. There's a programming certification process that's excellent. As a former reentry director, I have to tell you, I love it that when a woman finishes a program, she gets a certificate and her entire program transcript is printed on the back of that certificate. That's such a huge help when you're going to talk with the court or anyone about the program experiences that you've had. And one of the things that we saw is even with the current staffing challenges and challenges related to COVID, there's a real commitment to making sure female staff are always available on the housing units when women need them because of sensitive issues or sensitive times. So as you go through the report, you will see that there are a lot of other strengths that we were able to find. These are some of the foundational ones. I think a couple of others I would like to add here that aren't on the slide is, as we talk to the women, one of the things that we heard very consistently is that overall they do feel safe. We don't hear that everywhere, but we did hear that at this facility, and that they feel like that if they don't, if they had a concern about safety or another concern, there would be someone they could go to talk to within the facility. So that to us is a very kind of positive guidepost for the facility. Also, as with any facility or agency in transition, you're always going to have staff at a variety of different points in the transition process. So for some folks, they're early adopters and they'll look at new strategies or approaches with women and just immediately jump on board. Others will kind of wait and see and evaluate it a little bit and see if they think that it's something that could be useful. And there are a few others that will really dig their heels in. So those are three groups you have anywhere. One of the things we noticed though was that for most people that we talk to, for staff, while they acknowledge that it can be hard to change those older ways of doing things, they understand why doing that is important for women. And that's another just really foundational strength that you can build on and build a great program on. The recommendations throughout the report really do fall into a few different categories. So the first one is just enhancing collaboration efforts both within and within the community between the department and the facility as well as community members. One of the things we know from that foundational research is that women are very relational. They pursue change, they define change in the context of relationships. And to that end, women need that relational connection between their providers and their helpers as well. It's helpful for them if we are all connected and speaking the same language, which is a lot of what I hear on these calls. Also within the agency, again, like any agency in transition, you see areas where there's very strong collaboration. For example, strong collaboration between custody and clinical partners. And you see areas where that's less strong, depending on some of the folks who might be involved. And so throughout the report, you'll see recommendations for how to build in interconnectedness and collaboration to just continue to strengthen that process of working together consistently. The next category here is operationalizing gender responsive practice. I was a women's services director in a large state system. We had 22 prisons, about 54 parole offices. 2 of those prisons were women's. And when I started at that agency, I was new to gender responsive practice as well. And I remember feeling like and hearing, all right, Tina, go forth and be gender responsive. And walking out of that meeting thinking, yeah, I want to do that, but I'm just not exactly sure how. And that's one of the things that I think systems around the country are really looking at. We know the importance of programs, we know the importance of services, but how do we really operationalize this on third shift when an officer is in a unit and you have a woman who's having a nightmare related to a former trauma? How do we help that officer build the skills that they need to be able to handle that in a way that is supportive and not re-traumatizing? So a lot of our recommendations will go towards operationalizing this practice through policy, through training, and through building structures and systems. So for example, we do make some recommendations around human resource processes, such as making sure that expectations around work with women are included in job descriptions and performance evaluations so that staff really understand what those expectations are and can get some coaching and support in reaching those goals and really coming to be an expert in work with women. We also know that you have had a staffing analysis, and staffing has been a concern for the facility for a while. When you lay a gender responsive lens over that, once you're looking at staffing numbers, you can also look at deployment of staff and how we use staff, both male and female staff, to create a safe environment that has the right kind of role modeling for the women, and also make sure that there's safety during those sensitive times. So there's information in here about how to overlay a gender responsive lens onto those staffing recommendations. Similarly, we talk about enhancing some of the classification and program assignment processes by including a risk needs assessment that was designed specifically for women. And I know that based on how things are structured, this would probably land with the ROs, the rehabilitation officers. But one thing we know is that when we're using gender neutral assessments to come to understand the needs of women, there are often questions that aren't asked. And so if you look at a tool like the LSIR, which is a gender neutral assessment, that tool, for example, asks about housing availability. When you look at the WRNA, or the Women's Risk Needs Assessment, that tool asks about housing availability and safety. And for women, that and safety component is a really important piece. I've seen way too many situations where women have been willing to go back into a dangerous system or a dangerous housing situation if they felt like there were no other options. But also, if we don't ask the question, we may not always know that there is a safety concern. Well, you know, I was interested in the presentation just before talking about the quick turnover and those folks who are in 3 days or less. You certainly won't do a risk needs assessment for every person that walks through your doors. There's a way to implement that will help you to identify immediate needs for those folks coming in and turning around and going out of the system pretty quickly, as well as those folks that you have a little bit more time to work with as it relates to building a good solid case plan that can follow them from the facility into the community. We also do recommend in here.
You know, this is Cindy. What I want to ask is, I'm going to ask if you could wrap up, because I want to make sure we lose people at about 4, and I want to make sure people have a chance to ask questions, if that's okay.
Sure, absolutely. So I'll just, one other thing I do want to say is that we do recommend in here working to implement a system-wide case plan, something that would follow women from the jail into the community. The remainder of the recommendations really center around mitigating physical plant challenges, formalizing orientation, and making sure that we're measuring anything new that's implemented so we know if it's working the way we intend to. So there is a slide on next steps, but I will absolutely be happy to answer any questions that you have.
That's great. I'm going to go to the public, and then I know there are a couple of us that want to talk to you. So we'll go to public comment and then come back to Tina and the sheriff.
Perfect.
Speaker is Ron Hansen. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will begin when you begin.
Yes, thank you. I'm Ron Hansen. I'm a public member of the public. There are 2 points that I wanted to quickly make. One is based on the report, it sounds like things are really pretty nice are running pretty smoothly at CCW. That seems to be counter to the grievances that are filed at CCW, which tend to be anywhere from 3 to 5 times higher on a per person rate than either of the other 2 jail facilities. That's one. The second is in the recommendations, it was seems to be focused primarily on CCW administration and the sheriff's office. And I'm curious if there is any role to play in the Department of Correction in doing this work. Thank you.
Thank you. I'm going to go now back to I'm going to close the public comment, and I'm going to go to Tina. Did you want to respond to that? And then I'll go to Christine.
So a couple things I would say. One is that while there are strengths, there are certainly ways that the facility can continue to improve and that the community system can continue to improve as it relates to building those systems related to gender responsive practice. And so that I think that is one important thing to remember just in terms of the scope of this particular assessment. And absolutely, we believe there's just a system-wide need for collaboration to strengthen a system to really work as well as it can for women in the county.
Thank you. Christine?
Thank you, Tina. Thank you so much for your report. That was really informative. I just want to piggyback on something Mr. Hansen just said, and in collaboration, is the Department of Corrections going to be folded into that, because they do oversee booking, and it seems to me that you would want to have that overlay of gender responsiveness and gender neutrality in the whole booking process and the assessment of people when they're first coming in for what their mental health needs are, et cetera, et cetera. And
sure.
I'm just hoping that that process is going to be folded into your collaboration going forward. Thanks.
Thank you so much, Christine. Lori, Sheriff Smith, do you want to weigh in?
Yes, if I may, just in response to the Department of Correction, you know, the Department of Correction is admin, booking, warehouse, food service, and laundry. None of those parts touch CCW. If you look at the booking process, all women are booked at the main jail downtown, but that's not part of what we were looking for the gender needs assessment. So DOC is not a factor, but in fact, the study really looked at everybody. They talked to ROs and things like that. So the booking process would have to be a different study if that was something that needed to be done. But DOC is kind of a misnomer in what this study was.
Thank you, Sheriff.
Thank you.
So just go ahead.
Oh, I was just going to say, we were able to look at the booking process, and I believe one of the recommendations in there was to take a little bit of a deeper dive in there as we work with the sheriff's office through technical assistance, especially as that relates to just how do you align an orientation process that sets women off from jump with the things that they need. And that often includes things like making sure orientation processes are very interactive and that we are addressing the things that we know are most important to women, such as visitation. How do they know the rules? How do they write letters to their families and things of that nature?
Right. So I wanted to just make a couple of observations. One is that I thought the report was very, very informative. I thought it was very thorough and really helpful to getting a framework of how to approach the changes that we need to make. And I thought in particular, it was really clear to me that there was good communication between you and the sheriff's office and the correctional officers. And I think that's just so helpful to kind of getting to the bottom of what we need to make improvements around. One thing I wanted to ask Sheriff Smith is that I'd love to have now that the studies happened and the Moss group is going to be working with you in April, I'd love to have you guys come back with what are the things you see that you need to prioritize, because there was actually a lot here. And I know we can't do everything all at once, although I always want to, but like, what do you see, Lori, as the priorities? And then what are the timelines that are going to be included? And then as you figure out priorities and timelines, what are the resources that are going to be required to get to the priorities, timelines, and then outcomes that we really want to see for women? And then one last point is that it would be great to be able to do, have a mechanism for doing report backs from the women who are in custody to better help us understand for each of the items that we've prioritized, whether or not they're seeing the changes. And I think, Tina, like, I think it's been all of our dream that we have the ability to really help people succeed once they leave, and that really requires a continuity of services. So if they're getting mental health services inside, what do those mental health services look outside, and how do those connections happen? So that I recognize important high level of complexity. So, but that's got to go on the timeline. So could that, Sheriff Smith, come back to us in April?
Yes, and priorities, number one priority right now is staffing, but I think everyone is aware of that. I think there's many more programs that we could do for women that will prepare them for future employment. And I wish that we had some of the non-traditional women's jobs for training, some of the construction trades. So that's an area I would like to focus on. And again, I really want to thank the Moss Group for commending our staff out there. That's very much appreciated. We know that they do a good job, and I'm glad to hear that. We've got a lot of room for improvement. And let me comment again on the admin booking. Admin booking is not located anywhere in the jail. All of the booking that's done at the lower level is done by sworn personnel. So I'm not sure that a lot of people knew that. And Christine, you saw admin booking this morning, and that's where they said not in the jail. So I appreciate and really look forward to also hearing comments about women who are booked in the jail. But this is something that I think is very important, and we should definitely look at the success and the outcomes. So I truly agree with that.
Great. And so we'll see that in April. It doesn't, even a slide presentation just to get us on priorities, timeline, resources we think are going to be needed. And then and I recognize some will be complex, so maybe on a longer timeline, some will be more simple. Well, thank you all very much. And I'll look forward to April to get a chance to see you. And thanks again for the report. I really enjoyed diving into it.
Thank you so much.
Thank you, colleagues.
Thank you.
We are wrapped up. That was our last item. Let me just confirm this, that I believe I'm right about that. Our next meeting is going to be Wednesday, April 6th at 2 p.m. And I do want to thank all of the staff who helped us get through this really robust body of work. Keep up the great work, everybody. I know we can always do better. And let's go forth, change the world and get better at what we're doing. All right, everyone, have a good rest of your day. Thank you.
Thank you.
Recording stopped.
Yeah.